During pregnancy, your abdominal muscles can separate. That's the two rectus abdominis muscles that you have here. And they separate right at the midline here. What happens is there's kind of a gap between the tummy muscles, and there's a connective tissue that comes across those two muscles, which can also stretch and weaken and become quite thin. So what we're going to do is we're going to test, I'm going to show you the rec test for diastasis, just to see how wide that gap is. And also we're going to stretch and see the integrity, see the strength of the connective tissue in between as well. So we're going to lie on our back. Okay, knees are bent, feet are flat to the floor. You're going to just take 2 fingers, okay, and we're going to measure the gap just 3 centimeters roughly above the belly button. So 3 centimeters above the belly button here, and then we're going to place 2 fingers here. Just breathe in naturally, let the tummy rise. Exhale, lift the head and shoulders, and just push your fingers down at the midline here, in between, to see if you can get the fingers in between the gap. Breathe in and relax and down. You're then just going to measure about the belly button, just literally above the belly button, not right in. Okay, 2 fingers again, maybe 3. Okay, breathe in, exhale, and just drop the fingers right down and see how many finger gap you can get in between those 2 muscles. Now if it's more than 2.5, 3 fingers, or even 4 fingers, you do have a diastasis. Also going to measure the tender point here just below the belly button, about 3 centimeters below. Again, turn the fingers, so 2 to 3 fingers. Breathe in, exhale, lift the head and the shoulders, and just push the fingers down here to see if you can get or feel any gap between the muscles. Breathe in and relax. So really you're looking out for a gap that is wider than, say, 2.5 fingers, okay? Anything wider than that, then we do call a diastasis. And you really need to work on the pelvic tilt exercise that I show you. This is the pelvic tilt, and it's a really key exercise to do when you've just had your baby. It's really going to help heal any diastasis and bring those abdominal muscles back together. So it's a very subtle exercise. We're going to lie on your back, your knees are bent and the feet are flat to the floor. Okay. You're going to take your hands and just place them on the waist like so. I'm just going to kind of lift my top a little bit so you can see. Okay. The hands are going to go right on the waist here with the fingers pointing towards the belly button in your midline here. You're going to just take a deep breath in, let the belly just rise, and then you're going to exhale. Draw the belly button down to the floor and tilt the pelvis up and away. Okay, I'll just show you from the back angle here. So you're taking your pelvis up and away. You're not actually lifting your hips off the floor. You need to keep the hips on the floor. Drawing the abdominals together with your hands. Breathe in, relax, and then exhale, bring the abdominals together and tilt the tailbone up and away. If you want to try and do 10 of these. Really bring those abdominal muscles together. This also helps with strengthening the pelvic floor. Try and avoid flattening your back right into the floor in this exercise. It's more a case of drawing the belly button down, bringing the abdominals together, and lifting the tailbone up and away, but without lifting the hips off the floor. One more.